A 60-year-old man presents to the clinic with progressive difficulty swallowing solid foods over the past several months. He describes the sensation of food getting stuck in his chest, especially when eating meat or bread. He reports occasional regurgitation of undigested food but denies any weight loss, vomiting, or chest pain. His medical history is significant for long-standing gastroesophageal reflux disease, GERD, for which he has been taking a proton pump inhibitor intermittently. Physical examination is unremarkable. Which of the following is the most likely diagnosis? A. Esophageal cancer. B. Achalasia. C. Schatzky ring. D. Esophageal stricture. E. Eosinophilic esophagitis. Before going forward, please pause and write your answer in the comments. Now let's find out the correct answer. Answer: D. Esophageal stricture. Explanation: the patient's history of progressive dysphagia to solid foods, particularly with a sensation of food getting stuck in the chest, is most indicative of an esophageal stricture. Esophageal strictures are often a complication of chronic gastroesophageal reflux disease, GERD, where repeated acid exposure leads to inflammation, scarring, and subsequent narrowing of the esophagus. Unlike esophageal cancer, which also causes progressive dysphagia, esophageal strictures are typically not associated with significant weight loss or constitutional symptoms early in the disease course. Achalasia generally presents with both solids and liquids dysphagia, and a Schatzky ring often causes intermittent dysphagia rather than a progressive course. Eosinophilic esophagitis usually presents with dysphagia in younger patients and is often associated with a history of allergies or atopic conditions. The absence of alarming symptoms like weight loss, vomiting, or chest pain makes esophageal stricture the most likely diagnosis in this case, particularly in the context of his history of GERD. Key takeaway: esophageal stricture should be suspected in patients with a history of GERD who present with progressive dysphagia to solid foods, especially when there is a history of intermittent GERD treatment and no systemic symptoms. If you loved this video, please like and hit the subscribe button. We will keep uploading new questions on a regular basis.